Good afternoon, and thank you for joining me today as I report on the COVID-19 pandemic here in Erie County. We have 2 new confirmed positive cases of COVID-19 in Erie County to report today, which brings us a total of 40 positives across the county. We have 1,113 total negatives. Of the 2 announced today, they are both in their 20s and they reside at the same residence. How they contracted the virus is so far inconclusive, but contact tracing investigations by the Erie County Department of Health are underway. The updated map that reflects the latest cumulative cases by zone on the confirmed positive COVID-19 cases across Erie County will be posted today at eriecountypa.gov. On a statewide level, there are 1,366 more cases and 17 more deaths in the past 24 hours, to bring us to a total of 24,199 positives and 524 deaths. Warren County still remains with just 1 case. Crawford County has 16 cases, and Allegheny County has 876 cases, including 21 deaths. And today I did a little further investigation in comparing Erie County to the other counties across the Commonwealth. And 34 counties have more cases than Erie County does. And as I've said before, we rank number 15 in terms of our population. And as I looked at the counties that have populations of greater than ours, none of them had less than 200 cases. And even those few counties who have a population just a little bit less than us all had quite a few cases. So again, I think we are doing the right thing here. We are really keeping our numbers down, and we are bucking the trend of what you see happening across the Commonwealth and truly across much of our country. But I'll say this again. First, thank you for all of you who are doing the right thing, who are staying at home, who are following the orders to wear a mask when you go out, and to really limit your amount of time that you are out and about amongst others. So please remember to wear your mask. I know many people have reported to me that when they go to a store, they're uncomfortable because so many people are not wearing a mask. But even a bandana or a scarf tied around your face, if you don't have access to a homemade mask, works just fine. Some way to cover your nose and your mouth so that the moisture from your nose and your mouth when you're speaking and even when you're breathing does not come out into the air and potentially infect another person if you happen to be one of the people who are positive with COVID-19 and have no idea that you are. And again, staying 6 feet away from anyone else is also very, very important in keeping that physical distance between you and another person who does not live in your home. Our environmental task force team continues to make field inspections, and they are available to help any business who wants to know how they can, who's open because they're a life-sustaining business, and how they can be better compliant and keep everyone safe. And lastly, if you need information or guidance, of course, you can always go to eriecountypa.gov, or you can call us at 814-451-6700, or certainly email ecdhinfo, I-N-F-O, at eriecountypa.gov. Next, I want to express my sincere gratitude to the staff here at WQLN-NPR for their extreme generosity. For over 3 weeks now, the station has been a partner with myself and county government, as well as our local media stations, to allow us to be able to provide these updates to you. And normally this time of year, I think many of us know that QLN-NPR would be interrupting our programming for their annual fundraising drive. This year, everything is different for all of us, including our nonprofits. And QLN has decided to direct as much time and energy as possible to covering the COVID-19 outbreak and keeping you informed and safe. We know that we all count on WQLN-NPR to keep us informed. QLN is always here for us in the good times and during these challenging times. So I ask all of you to please consider supporting WQLN during this time. You can donate at WQLN.org or call 814-866-5454. And while I'm talking about nonprofits, we know that so many of our nonprofits are really struggling right now. And so if you are able to, and I know many of you maybe are not because of the job loss and unforeseen financial constraints, but if you are able to, please think about supporting these great nonprofits who really are so much of the great assets of our community and the backbone of really our community in many, many ways. Pennsylvanians who are looking for work now can now find life-sustaining businesses that are hiring through a new online COVID-19 job portal that's at the Department of Labor and Industry. It's being launched today. So people that are seeking employment can visit pacareerlink.pa.gov and select the green PA COVID-19 Jobs Hiring Immediately job portal banner to see active job openings. So again, you can go to pacareerlink.pa.gov and select the PA COVID-19 Jobs Hiring Immediately portal. And there are many job openings there, so please take advantage of this. And finally, last week was National Public Health Week, and this week is National Public Safety Telecommunicators Week. Our Department of Public Safety and Emergency Management first responders, they are the first responders, and they've been working hand in hand with the Erie County Department of Health from the beginning of this pandemic. So if you'd like to show your appreciation for these hometown heroes, our public safety telecommunicators, you can write to them or email them some thanks at publicsafety@eriecountypa.gov. Sometimes our hometown heroes are very visible to us, and sometimes they are not. But that person who answers the phone when you call 911 is that first responder, and I thank them for the work that they do every single day, but particularly on this week when we especially commemorate the work that's done there. And so with that, I'd like to open it up to the media, and we'll start today with Erie News Now.
Hi, good afternoon. A question for you about our relatively low and fortunately low numbers here of positive cases. You pointed to other counties that certainly are not in the same boat we are. Do you think that our numbers are particularly low because we've just done a better job than everyone else of getting ahead of this early, or do you think it's a lack of testing, or maybe a mix of the two?
I don't think it's because of a lack of testing, because I think a lack of testing is happening all over the Commonwealth and really all over the country. So our lack of testing is really comparable to any other communities. I think it's because we got on things early. I think it's because we have an excellent health department who have skilled people who can do the things that we know that work. Contact tracing is now being hailed from the CDC and Dr. Fauci and so many others as being a huge tool in really getting a hold of this virus and stopping its spread. And so our team at the Erie County Department of Health, from the day one, the first case, has been doing an excellent job doing this contact tracing. And that is when they have a long interview with this person who's sick and able to find out who they might have had contact with, and then contacting those individuals and having those people stay under quarantine for 14 days. So getting them out of society, keeping them contained, and then stopping the spread. And so we are really seeing huge benefits to doing that very, very detailed work, but very necessary work in containing the virus. Talk Erie?
Yes, good afternoon. Hi, it's Joel. I wanted to circle around to a conversation we had last week about the number of ordered quarantines that you and the health department have issued. Do we have a number of that, and how often are they checked in to make sure that that 14-day quarantine is definitely in place, and do we even know how many quarantines have turned into positive cases?
So I don't know those numbers offhand, but I asked my team earlier today to try to start to dive into some of those numbers for me. And I also asked them, and I'm hoping by tomorrow I'll have an answer on this on terms of the recovery rate. Of course, our work has really been on trying to stop the spread, and that involves a lot of different things. But I do think it would be really important and good for me to report sort of those number of people out of those 40 who have already recovered. And then if we can get some sense of the number of people under quarantine, I think it might help answer some of the questions that have been brought forth. So they're working on that for me.
Thank you.
Jet TV?
Yeah, hi, Kathy. It's Samir. I wanted to, talk about WabTech a little bit. Has the team gone back out yet to the facility, and what did they recover?
So we had 2 teams out there late last week, and again, it was a good visit, very open visit on behalf of WabTech and the management out there. It was a surprise visit. They didn't know they were coming, and yet we had a good report from WabTech, and we got into even more places that we hadn't got into the first time. And so many of those buildings that we hadn't gone the first time really have very few people working there. It's more maybe of a warehousing type of a building, but we still felt it was necessary to check all the buildings where people might be working. And again, WabTech was very open to any specific changes that the enforcement teams offered them. So tweaks here and there, they're putting in more on the floor tape, I guess you would call it, that shows where the 6 feet measurement is around, especially around certain areas where it might be a little bit tighter in moving from one piece of machinery to another. So it's things like that they continue to expand on, and we'll continue to make visits to WabTech, and again, we're out there to help. We're not out there to hinder. We're really trying to help businesses do the right thing.
And then I also, since we're on this topic kind of an area where I guess community spread could happen potentially, do we have an area yet through contact tracing that we see, like I guess a hotspot or anything yet?
We have no hotspots listed. As we've been reporting here, the vast majority of our 40 cases have either been someone who had traveled outside of our region and then came back and became positive with symptoms, or had a connection to somebody else who was positive. So we've had very, very few cases that we haven't been able to pinpoint sort of where they most likely picked up the COVID-19. No hot spots to report at all in Erie County. Erie Times News?
Yes, Kathy, it's David. I want to talk a little bit about exit strategies. Governor Wolf was part of a multi-governor press conference about an hour and 15 minutes ago. They haven't had any details, but they're going to have a coordinated response to getting out of the stay-at-home orders. Want to get your thoughts on that in general, and then also, might Erie County have a different timetable because of the relatively few cases we've had?
So I didn't have a chance to watch the governor's press conference today, but I will say from what I have been hearing, it really is going to be a strategy that's going to look at a community, and I've even heard it could be a county-by-county strategy across the nation, looking at counties where we don't have some of the issues that they do in other places, and maybe potentially we would be opening up things sooner. There's no guarantee. I can't promise that to this community right now. There's a lot more work that would have to be done, and we'd have to, still have some guidance out there. It wouldn't be just open back up and go back to the way we all were living in, let's just say, January or December. So, there's still going to be a need for all of us to be very, very careful and very safe, even when we do get back to reopening parts of our economy in this community that aren't open right now. But I don't have any more details on that than just sort of that general thought process.
And just to follow up, how encouraged are you? I mean, the last couple of Mondays have been the days with I believe, looking back, the highest numbers we've had because of weekends, because of maybe lags in reporting. Only having 2 cases today, is there really a growing confidence that this is what we're seeing, a couple cases a day?
The growing confidence is that we think we're actually doing the right thing, and we are making a difference by doing that, and we're going to continue that really difficult and tedious work. But having only 2 new cases to report today, none yesterday, and those 2 new cases live in the same household. And so in some ways you could almost look at that as one case because, they're residing in the same place and they probably were together, when they contracted the virus. So I think that's obviously extremely encouraging news for our community as a whole. We continue to buck the trend, as I said, whether we're talking the Commonwealth or across the nation, and we're going to continue to do that. So I would have to say we're all not feeling overly confident, but we're just maybe breathing a little bit easier than we were a week ago as to where we thought things were going to go back then. But I don't want anyone to let up on all of the advice and the things we've asked the community to do, because it's because you all are actually helping us in doing all of those things that we are seeing this. I took a nice long bike ride around the peninsula yesterday. It was a lovely day, and I have to say how happy I was to see many people at the peninsula, but I saw social distancing everywhere, whether people were fishing, whether they were walking on the path. Maybe there were some people who weren't quite 6 feet apart occasionally, but I just saw great habits, people doing really well and trying to follow the recommendations that we're asking people to follow. So please continue to do that. You are a big part of the reason why our number sits only at 40 when so many others' numbers are just such larger numbers than we have for our population. Erie News Now?
A question for you about this past weekend and then looking forward to this week. Coming off of the holiday weekend, do you worry at all about seeing a little bit of a spike in cases this coming week just because of, although they shouldn't, some families getting together just a little bit more? I realize weekends tend to be a little bit more social anyway, even though they shouldn't be, but especially with that holiday weekend. Is that at all a concern this week?
I guess it could be a concern, and we'll see what happens, but I'm just talking anecdotally. So many people I talked to just spent the holiday by themselves or with just the people in their home, and they had a very simple and very, very different holiday weekend than they normally would have had. And I'm hoping that that's the way with the vast majority of people in Erie County, and we won't see any big spike from that, but of course it's always possible. Talk Erie?
Yes, just the discrepancy between the state and the local numbers. We were talking about 38 now to 40. The state still got us at 39. Is that just a lag in the data at this point?
So we are at 40, but we have 2 new cases today, which of course, according to the state numbers, would put us at 41. But they're 39. If you remember last Saturday, it showed up on the state numbers, and we weren't sure why. Well, we've clarified that now. That number actually will be going away from Erie County and being put in New York State where it belongs. So an individual was actually tested in New York State, and it appears that they must have lived here and maybe haven't changed their driver's license or something about their permanent address, but they were tested in New York State. They reside in New York State. They do not reside in Erie County, Pennsylvania. And so we've been in touch with the state. Remember, this is a big database that's statewide and then connected to a national database. And so that number, we were calling number 39, will actually be going off of our numbers. And so then if we add the 2 from today, that takes us to 40. So it was a little bit of a mystery for us on Saturday, and we've cleared up that mystery, and the state's numbers should reflect that. Now, the state numbers, as you know, come out around noon. These 2 new cases today came in this morning, so by the time we open that case and get that started and into the database, I'm not sure when the state pulls their numbers for their release at noon, but we often, as I'm here talking to you, are a little bit above what the state numbers show for our county, and that's mostly because we have the right to the moment, up-to-date numbers out of our health department here in our county. I hope that clarifies that for you.
Thank you.
Sure. Jet TV?
Yeah. So we obviously were in this point in time where they were saying we were supposed to see a surge. Erie County obviously didn't see a significant surge. So I guess is it safe to say we kind of are flattening that curve within our community?
We certainly have flattened the curve. One of the reasons I kept talking about, a week, 2 weeks, 3 weeks ago, about flattening that curve was the devastation that could bring to our healthcare system and if we had a lot of people who had COVID-19 and then, of course, had serious complications with that and needed hospitalization. And, like we've seen in places like Detroit and New York City and New Orleans and LA and Seattle and so many others, even smaller communities than that. So flattening the curve was to help our healthcare systems be ready for the surge when and if it would come. So far, we have seen no surge, and we hope to keep it that way. So we feel very good about where we are at, but we know we can't take the foot off the gas, I guess, as you would say. We have to continue doing everything that we are doing to try to keep our numbers down. This is, again, a very sneaky virus. There is concern as we talk about reopening the economy. If we do it too quickly or we don't do it with enough care and understanding of what we all need to be doing, that we will be right back to the same situation, and we would see just a shutdown of the economy again and right back to a stay-at-home order. And that's what we want to try to avoid. So we want to continue to do the good things we're doing, keep our numbers down, stop that virus from having a home. That's why we put people in quarantine for 14 days. The virus doesn't seem to be able to exist much longer than that. So if you're a person who pretends maybe as a carrier and not know it and you're quarantined, then after 14 days you should be fine to again be able to go to the grocery store and do those other things. But obviously right now we're not ready to open up the whole community and let everybody just roam as we always normally do.
Right, and then I do have a follow-up question. This is in regards to testing in rural areas. Do we currently have a site in, like, let's say, Wattsburg or Union City?
No, we do not. The testing, remember, is not done by the county. The testing is done by our health care entities. So our UPMC, St. Vincent Allegheny Health Network, LECOM, and they are doing the testing, and so they are responsible for those sites. And they do have some off-site sites, as you probably know. UPMC's is downtown, and Allegheny Health Network has one out on West 26th Street, and LECOM is doing some testing also, but we don't have them in all of our rural communities. People will have to drive to one of those facilities in order to be tested. And to go get tested, you can't just show up. You have to have a doctor's order to do that. There are some private physicians who can also test, and that is being done in some of their physicians' offices also. Erie Times News?
Kathy, just want to follow up a little bit on getting out of the stay-at-home orders. Have you had any, or anyone from your staff had any discussions with state officials in the last few days or late last week about possible dates for starting to open up? Has it reached that stage yet, at least where you're talking? Because I know last week you said you really hadn't even talked with state officials about reopening.
So far, we've not had any discussions about that. Think about where we were a week ago. We thought we were going to see a very bad week last week. And we seem to have gotten through a week with a little bit of leveling off in some of the worst hit counties. Stabilization there, and in our county, also very similar in terms of our numbers not surging like we had thought they might. So if this continues, if this trend continues, then I would hope that we would start to be able to have those kind of conversations and start to think about what this looks like going forward. But we know the governor has already decided there will be no school for the remainder of the school year, which normally goes into early June. So we do know that is already in place. And so what the rest of this looks like is still yet to be determined, but there have been no conversations as of yet.
Okay, and just a quick follow-up on the basic stats for the virus. Still, there has been no COVID-19 related deaths in the county?
No COVID-19 resident, no Erie County resident who's had COVID-19 has passed away. We know that there was a Chautauqua County death that happened in one of our facilities. I'm not aware if there's others from other counties and other states, but none from Erie County. No, none of our cases.
And just how confident are you that the death is zero? I mean, are you very confident that any COVID-19 death of an Erie County resident would be reported?
Yes, I am, because that actually would show up in that report, that NEDS report that I've been talking about, that big database, that would show up. And as you can see, if you look at that, when it comes to Erie County, it shows us with no deaths. And of course, the only difference would be if there had been a death in the last 12, 24 hours that we didn't know about. But unless there's something out there that we don't know yet, there's no deaths to report. Erie News Now, do you have any last questions?
Yes, please, if I may. With these untraceable cases, you try to stop community spread. Do you happen to have a number on how many of those 40 cases county officials just haven't managed to find a way to figure out where the person contracted the virus?
As we've gone through this, it's been a handful, I believe less than 5, so really a small amount. But, we still have a few active cases right now that we're looking at and trying to figure out exactly where that is. So I don't have an exact number on that, but it's very small.
And as you look toward reopening the county down the road at some point, do you have an idea of how long you'd need to see this slow, just 1 or 2 cases a day, before you start to say, all right, it's time to really look into this? Or is that something where you wait for the lead from somebody higher up?
I'm going to have to take the lead from people who have that kind of expertise. Epidemiologists, infectious disease physicians, the state Department of Health. Those people really are going to help us figure out when we start to do that, as well as my director of the Department of Health and her very able staff there at that department. So I'm going to take my lead from the experts on this. Talk Erie, do you have any last questions?
Yes, just one more question. Go back to a question I asked last week about the African American community. Today on a podcast, Marcus Atkinson is gathered a panel regarding the impact on African Americans that this COVID-19 seems to have in a disproportionate manner. Any official acts from your health department or from any of your administration to reach out into the African American community for a higher level of communication?
Yes, we are, and actually there's been a conference called Today I Know. We're actually digging into those numbers a little bit more, of course, than we have been. Not that we haven't been, but one of the things that is important to remember when we're looking at these cases across the country that have been rightfully so brought forward and brought the attention to, in Erie County, we've had so few people even hospitalized, and of course we've had no deaths. So part of the thing when they talk about this and the inequities is when those people of minority status contract COVID-19 and then have complications, they are dying in much greater numbers, and it's much more severe because of the poor health outcomes in that population in general. And so this is really a much, much bigger issue that many of us have known for many years has happened in our country, that people of minority status just don't have the kind of health care outcomes, the health outcomes that others do, because they don't have access to good medical care, good preventative care on a daily basis, on a yearly basis. And so I'm hopeful that this COVID-19, as bad as it is, may shed a real spotlight on this issue, and that our country as a whole and our Commonwealth, and then of course down to our county, we can all do better in serving all people, and particularly those who have not been served well, and that's many in our minority community. So yes, we are working with them. We always work with them, but this just gives us another incentive to even look at this a little bit deeper.
Thanks.
Erie Times News? Oh no, I saw Jet TV. Do you have any final questions?
Yeah, I do. So let's say we move past this and then coronavirus turns into something out of like the flu where it's kind of seasonal. I guess what precautions would be taken? Is this something I guess the health departments are even talking about right now, about this possibly turning into a seasonal virus?
Well, we haven't really been talking about that because we're in a crisis mode, and we're really trying to just stop the spread of COVID-19, and all of our energies are going there. I mean, it's really hard to even explain how much time and how much effort is going into every day trying to stop the spread of this. There will be a lot of things to discuss going forward. If this became seasonal, I would imagine that would be because we found a vaccine and we found treatment for this. Now, vaccine, I hear, is probably 18 months away at best. That would be a very fast track for a vaccine, but there obviously are many smart people, many talented scientists working on that right now. We also know if there was a way to find out if people had immunity to this already. People that we know that have had it and didn't know they have it. So if we could test people to figure out who may have that immunity, that's also going to be very helpful. So there's a lot that could happen and would help us control this. And of course, just like anything else, whether it be influenza, tuberculosis, HIV, STDs, all of those type of communicable diseases, the health department tracks those, helps to mitigate the spread of those through our contact tracing, and we'll continue to do all of that, just as we have for years and decades. But this is going to be a new one, and we'll learn as we go, and we'll have, I'm sure, some different strategies around it, just as we did when HIV became a concern and an issue in our country. We came forward and took the role of helping to mitigate the spread of that in our communities, and we're still doing that today. It's obviously much less of a concern than it was a decade, 2 decades ago, but it still is a concern here. And so those are the kind of things that this health department does. And again, I can't say it enough, this community should be very grateful that it has a health department, because there are only 6 county health departments in the entire Commonwealth. And so all of those other counties are really just left to the State Department of Health to do this kind of work for them. So anyway, that's just something that I don't think anyone's ever really truly appreciated, maybe till this moment now. Erie Times News, do you have any final questions?
Sure, Kathy. When the time comes, whether it's a week from now or a couple weeks from now, when you talk about an exit strategy from the stay-at-home order, will you have discussions with leaders from nearby counties, such as Crawford and Chautauqua and Ashtabula, because of the travel between the counties? Will that go into consideration, or will it be strictly a discussion with state officials and then within the county itself?
I think it really needs to be looked at regionally. We've talked a lot about the numbers, not only in Allegheny County, but over in Erie County, New York, which is Buffalo, and then of course Chautauqua County, and then over Ashtabula County, and to Ohio, Cuyahoga County, which is Cleveland, and how much connection our community particularly has to those 3 big communities of Cleveland, Buffalo, and Pittsburgh. We have connections for our health care, we have connections for sports, we have connections for family, and so I think we really need to look at this regionally. Those 3 communities have had many, many cases of COVID-19. Allegheny, as I reported, I forget the number, but it's well over 800. I know that Erie County, New York, which is Buffalo, has had well over 1,000 cases, and I haven't looked at Cuyahoga's in the last few days, but theirs have been also well into, I think, high, the 600, 700, 800, I don't remember exactly. So we would want to look at this from a regional perspective, and that would probably involve some guidance for our citizens about travel to other places, whether it be those 3 communities or to even places beyond. Businesses, as they ramp up, will want to start potentially sending employees traveling again. Of course, that has a risk with it, that brings with it. People are itching to get out and about, and they're also kind of itching to go see their family. So whether their family lives in some of those 3 places I talked about, or whether they live in Chicago or New York City or Florida or wherever they live, people want to go do that. People have second homes in Florida and other places, and they might want to go do that. So we would really need to think about this and what kind of guidance we would bring out to our citizens, and that's where we really need to look at this, I think, nationally and certainly regionally. Okay, with that being said, I think we've about come to the end of our time here today, but I appreciate everyone joining me again, and I will be back all week here at 3 p.m. to bring you an update from Erie County. Thank you for staying home, for staying safe, and for staying calm.